with this week's Cardiology Countdown, we have reports in hypertrophic cardiomyopathy and two interesting reports about medical therapy. So at the number 3 spot is the report this week in Circulation, Cardiovascular Interventions, that has 279 patients undergoing 313 procedures with percutaneous transeptal myocardial ablation for hypertrophic cardiomyopathy. This is alcohol ablation. And they found excellent acute and long-term results. So they found that the acute hemodynamic benefits were very clear. And indeed, clinically, they found that the patients with class 3 or 4 heart failure fell from 94% at baseline down to just 21%. And this was preserved during follow-up. Syncope went from 18 down to just 2%. And so they also reported mortality that was just 3% at 1 year and 33% at 10 years, which was just slightly higher than the adjusted mortality in the general population. And so very excellent results with alcohol ablation, noting that this is really becoming one of the frontline therapies for hypertrophic cardiomyopathy. At this week's number 2 spot is an analysis from the PCI registry of the NCDR, looking at the use of optimal medical therapy in patients undergoing PCI for stable angina. Optimal medical therapy was seen to be key as part of the COURAGE trial, and so they looked at whether before and after that trial there were any improvements. So they found coming into PCI, only about half of patients were on optimal medical therapy, and that was defined in this study as just 3 classes of drugs: antiplatelet therapy, statins, and beta blockers, all seemingly pretty standard treatments. When the patients left the hospital, 2/3 of them were on optimal medical therapy. But that didn't change over about a 4-year period spanning before and after COURAGE, and still seems quite low for seemingly basic therapies for PCI patients. And so this is a call to action to try and optimize medical therapy for PCI. And at the number 1 spot is an interesting analysis about the complexity of medical regimens. This was an analysis from CVS pharmacy benefits that cover about 50 million patients across the country. And they looked at patients who were given either statins or ACE or ARB, which comprised 1.8 million and 1.5 million patients respectively. On average, those patients who were given statins filled 11 prescriptions of 6 different classes of medications, did this prescribed by 2 different doctors, and made about 5 trips to the pharmacy in order to fill those prescriptions. They then looked at compliance over the next 12 months and found that the greater the complexity in their refills and prescribing, the worse the adherence. So it was about 8% worse for each complexity level. And so they argue that bunching up refills so that one could refill medications all together and having potentially one prescriber as the key driver of medications may be ways to improve medication compliance. And so an interesting look into ways that we can improve the overall compliance for our patients. So with this week's Cardiology Countdown, I'm Chris Cannon.